Shalom. Here we are. Good night. Good evening. Good night. Good evening. Good morning, Rose. My name is
Hi,
Dr.
Tova.
Fine. I am in Israel. We are live on TMS Roundtable, and I love every Monday night. Not only am I a week older, aging gracefully with Rose in Australia, Melbourne.
And this morning, which it's Tuesday in Australia, Monday for Omer and Tova, but Tuesday for me, we have got a wonderful guest.
Mm-hmm.
Dr. Omer Hirsh is a chiropractor, but his specialty is in children with difficulties, emotional difficulties, learning difficulties. Now, from my perspective and from speaking to Dr. Omer, they're all connected. They're all interconnected. Now, audience, if you think about your own lives and think about those little kids in the classroom that used to always get into trouble from the teacher, or maybe it was you, and then you end up with chronic pain. Just think about the trauma that feeling inadequate happened to you. Or if you've got your own children, see that if you correct them all the time, they'll believe that they're not enough. So over to Dr. Omer, and hopefully he'll expand some of these ideas that we've already talked about. Can I hand over to you now?
Yeah, sure. Hi, good evening. Good morning. Wow, where to start? Such a broad.
Start about you and your interest.
Yeah, well, that is also a broad subject. But let's start with me. So I'm a chiropractor. I'm married. I'm a father. I have 3 boys and a girl. And like you said, I have a specialty. The specialty is in functional neurology. And my subspecialty or my fellowship or my expertise is in neurodevelopmental disorders. Now it's kind of a clinical name, but the point is, like you said, is pretty much helping children with difficulty. Because the way we look at it is if there are symptoms, if there are difficulties, then it is very likely that somehow, somewhere during development, something didn't go as it should have gone. And development starts even before pregnancy.
Wow.
So the concept of epigenetics tells us that the way the sperm is and the way the eggs are affected these are things that are affected by what the parents do and what they eat and what they drink and what they breathe and how they think, even before conception and obviously during pregnancy, and even after. So a lot of the things that we consider to be, kind of benign, if you would, or not important, really are important.
That's right.
And one of the things that I usually add at the end of my lectures when I talk about what can we do to help, is one of the first things I talk about is a positive attitude, especially when you're trying to get pregnant and during pregnancy. Because if you constantly think, like you said, if you constantly say and think things like, this is not good, you're not good at something, you need to do better, and even when you talk to yourself, then your brain just keeps getting those messages, and that affects the way your genes are actually expressed. So let me elaborate on that for a second, because that, in my opinion, is the basis for pretty much anything that works. Doesn't matter if it's chiropractic or psychology or coaching or any touch therapy or even a lot of medicine, if you will. So our genes are basically a blueprint. It's the plan. Now, I don't know if you've ever been to a construction site, but rarely does the plan and the building match perfectly. Very rarely.
Very rarely. Analogy.
Great analogy.
I'm good with analogies. Now, having said that, all the options are there. All the options are in the blueprint, but only some of the options get expressed. Okay, and this is determined by how the DNA is folded and how it is how the proteins around it are stationed. That will enable the cell to either make it into an RNA, which is kind of a hot subject these days, and then into a protein, and then actually that gets expressed out into the cell and then into the body, or it won't get translated into RNA and then get expressed into the body. Okay, and this can be changed. That is the whole concept of epigenetics. It's the way the environment affects the way our genes actually get expressed. So some of our genes get expressed whether we like it or not, like the color of our eyes or the shape of our anatomy, stuff like that. But but many of our genes, especially the ones that relate to our life in the long term, so our development and our learning and our ability to interact with the world and our ability to incorporate things from the world, all of those things are affected by our environment, by what we eat, by how we think, but by barometric pressure, by the social environment we're in, and everything, etc. So let's go back to my specialty.
Good.
Once we understand that, then the way we look at it is we can actually affect the way the brain works by changing its environment, by providing the appropriate stimuli, by changing the diet, by taking away things. Now, changing the environment can be specific sensory stimuli like light or sound or vestibular or touch or anything like that. It can also be speech. It can also be, again, relationships. One of the things that I tell the parents that come into my office is, as we work on your child and we do all these stimuli to change their brain, and if you want, we can talk about examples a little later. You have to understand that you actually have to change the way that you see your child. You have to change the way you speak to your child. You have to change. You have to change the way that you speak to yourself about your child. Because, and this, I learned this from experience. One of the first kids I worked with, we went from him not being able to sit for 3 minutes, because we could do 3 minutes and then he would just, lose attention and start jumping around the office, to the point where we can work for 45 minutes nonstop, hammering his brain, and he can handle it. But at home and in school, there was very little change. And then what happened was he went from first grade to second grade. And his teacher from first grade went on maternity leave, and he got a fresh new teacher who just came to the school, didn't know him, and she didn't know that he was a troubled child.
That's right.
And he blossomed. He excelled. And then around April, she went into maternity leave. And the teacher who came in instead of her was one of the teachers who actually knew him from first grade. And within 3 weeks, his grades went down. It wasn't as bad, but his grades went down and his home, interactions went down. Everything spiraled down because there was no support.
Wow. And
so that, to me, was a big aha moment as to how much the way that the environment sees us and looks at us can affect the way we express ourselves, even if we can express ourselves in a different way. So when I work with kids or with adults, by the way, it has to be a multi modal approach. We have
family
to look.
Affair.
Yeah, well, I have that picture in my office. Chiropractic care is a family affair. I don't know if you've seen it.
No,
like
I have it. I had it in my office with
you have it here
with
the puppets.
Elmo and all the Muppets.
Well, I don't know. I don't think they're from the Sesame Street, but they're just puppets. But they're cool. I love them. I had 2 of them. Anyway, yeah, it is a family affair because you have to incorporate everything. You have to incorporate their brain. You have to incorporate their motor system, their sensory system, their self-awareness. You have to incorporate their nutrition. You have to look at their family. You have to look at their school. I always ask the parents to put me together with whoever else is working with this
Wow.
child, whether it's their teacher or their physical therapist or their
Wow.
occupational therapist or whatever,
Yeah.
because we have to work together. We have to make it into um, um, this cover that looks at this kid from all directions and everybody together helping them come up, helping them elevate.
Mhm.
Omer, how did you change that little child that you were talking about, who in grade 2 fell back? Can you explain
What
what
I did
changes you
before?
were able to make, for that family?
Well, first of all, it started with changing his brain. So we did a lot of sensory and motor stimuli. So for him, his right hemisphere and his cerebellum weren't working as good as they should have. And with ADHD, he was a very severe ADHD symptoms. Um, and what we know and what we work with, what we see clinically is that with ADHD, the right hemisphere is usually the issue because that's the brake system, while the left side is more of the gas pedal.
The go.
And so the go, yeah.
Say that
Uh,
again. That's very interesting. Which part of the brain is the
the right brain is the brake, and the left brain is the gas. It's the go.
wow.
Okay,
The right
that's like in a very
brain,
very general perspective.
will give you reflective capacity, connection to the right brain, whereas the left brain is impulse, and the right brain then becomes the impulse control. Would that make good sense to our
Yes, in a
listeners?
way, in a way. So the left brain wants to. It's motivated. It's the approach system. The
Yeah,
right brain is the withdraw system. So first of all,
lovely.
we want to make sure that everything is safe. So the right brain kicks in first. So in utero, the right brain develops faster than the left, the right hemisphere. When I say brain, I
Yeah,
mean hemisphere. Um, and then as the child ages a little bit and they're about 2 or 3 years old, the left brain kind of catches up and then it goes faster for a few years and then it kind of changes back and forth until we're adults. And for for men it happens at 85 and for women usually at 25. And but it kind of goes back and forth like this. And actually, whenever we see this kind of a shift from one side to the other, we actually usually see kind of a crisis, like the terrible twos, and
yeah,
around 6 or 7,
Wow.
we also see this crisis, and then around the beginning of puberty, and then again around 17,
Wow.
and then again for men, it kind of keeps going on for years. Um, so because first thing that has to happen is we have to make sure everything is safe. So we first of all we say no. We got to step back. And then when the right brain says it's okay, then the left brain kind of wants to go. Now, what the problem with ADHD kids and autistic kids and a lot of other right brain deficiency problems is they have the go. They really want to go. They really want to approach, but they don't know how to stop. They don't know how to take a step back. They don't know how to kind of calculate that they can't do it. And this is what was going on with this child. He was very in your face. He was very, very hyperactive, very, very impulsive. Um, and what we did was a lot of sensory and motor stimuli going to his left cerebellum and right hemisphere. So we used blue tinted glasses. We used light that was coming in from his left side. We spun him on a chair counterclockwise, only counterclockwise.
Amazing.
We did a lot of balance exercises, so on a wobble board or a balance pad, while he was doing different things with his left hand, like passing a ball or stuff like that, or tracing at figure eights. We worked on his diet, so we increased his protein intake. He wasn't eating any protein, and you have to have protein to build your brain. We increased his fats. We increased his um, green leafy vegetables.
that would have
Um,
been interesting.
I still love that.
that was hard. That was hard, but not as hard as I've seen it in other kids. He was actually not such a bad eater.
Okay.
He just wasn't eating enough. He was very, very slim, very, very thin. Um, and we did worked a lot on his primitive reflexes. That's a major part of what I do, especially in the beginning. I don't know how well you guys are versed in those, but We did work a lot on those, and then we did a lot of strengthening, so core strengthening and big muscle strengthening exercises to increase his muscle tone. So when you have bigger muscle tone, basically you generate more electricity and your brain gets more juice.
Wow.
And as your brain gets more juice, your frontal lobes become stronger. As your frontal lobes become stronger, they can then come down and inhibit everything else. And yeah, so that's what we did with him, and we did that for about maybe 3.5, 4 months. No, about 6 months. We worked with him, and after 6 months, we got to that point where I was telling you before. And then, actually, what happened after is the parents also saw this, slide down as the teacher got replaced, and they kind of stepped up and they started changing what they're doing. And the mother was actually finishing her process of moving from being in high tech to being a teacher herself. So I think she was a little more open to hearing that. So they did a lot of the work after that themselves, because the child was now able to receive all that because his brain was balanced. So now he could respond to the environment in a more, proper or logical way.
Yeah. Could we have a little pause for a moment and think about the results for children who don't get that support? Can you talk a little bit about that? Because that's a beautiful, beautiful scenario. And also the adults who experience that now, how they're going. Because this is the gap that we have. And it's all about motivating the parents to go to the right direction, isn't it? Or helping the parents understand what will grow the child, not just physically, but emotionally and spiritually and everything else, by being attuned to the child. And then you give them the strategies of how attunement will help them. Am I?
Yeah, in a way, partially. I mean, some areas I don't go into. I refer them to someone else who does, because I don't know how to do everything. But I do try to. But I do try to get to know people who do all the things that I don't know how to do or I'm not very good at. But yeah, the major part, especially in the beginning, is to get the parents to understand that whatever has been done so far hasn't been very efficient, hasn't been very productive. It hasn't been good for the child. Otherwise, they wouldn't be in my office.
That's right.
And it's not about placing blame. It's about, this is where we are. Now let's go somewhere else. And that's a step that most parents have a hard time with, because it's very hard for them to accept the fact that what they've done so far hasn't proven like they would hope it would.
Yeah.
I hope that makes sense. I don't know if it's a good sentence in English or not. I remember a mother who I met at this event, and I was talking to her about, we were talking about autism because she had a child who was diagnosed with Asperger's. And I told her that, we can change his behavior, we can change his symptoms. We maybe even be able to get to the point where he's no longer, meeting the criteria for Asperger's. I don't know, but it's possible. And it took them almost 2 years to come to me for care. And I could see that once I said that, the mom just went,
yep.
Because she's been working for 8 or 9 years on accepting the fact that her son is always going to be like that. And now I'm telling her, no, there's things that we can do. And so it's very hard for parents to kind of let go of the guilt feelings. So that's one of the things I try to get to with my parents. And then, we try to show them the way. I'm doing a webinar on Wednesday night, precisely for parents, to give them exactly that, to give them the concept that, hey, we can do things differently and you can actually help your child. And here are some steps. Because sometimes they can be very simple and very effective. In my perspective, there is no partition between the sensory system and the motor system and the emotional system and the spiritual system and the concept of mind-body. Is that how it's pronounced in English? Translated in English?
Psychosomatic, mind-body, yeah.
Well, no, like a lot of people are mind-body therapists.
Yeah.
In my perspective, it's kind of funny to say that, you can't be a mind therapist. It doesn't work. You can't be just a body therapist. It doesn't work. You always are a mind-body therapist if you try to help people. So it's kind of funny for me that people kind of emphasis that they are mind-body therapists.
Well, the beautiful
you can't
thing
one without the other.
Yeah, the beautiful thing that what you're talking about reminded me, and it, maybe I'm let's see if I'm a little off with this, but look, I know growing up, and I know a lot of people, the answer to any of these neurological functions was medicine. Like a lot of kids are on Ritalin, and that works, and the parents are like, it's working, don't rock the boat. Now, interesting enough is that there's more that people can, the children can be on the Ritalin and still get your work and even get off the Ritalin. So, you know, Rose and I will work with people and say, your Advil will work better when you understand some of the intimate connection between the mind and body. Your surgery will work better. So if you need to get the surgery, fine, still come and understand the principles. So what you're telling Rose and I and the listeners is that this is not against Ritalin. You're integrating, but you're even saying this is in itself stands alone. And the person could get off Ritalin. The kid could get off Ritalin. The child could get off Ritalin. Is that something you deal with? Or
yeah, we deal with this question all the time. First of all, I get asked, you know, they're taking this and that. Can they be, you know, can they participate? The answer is yes. Now, what we have to remember about Ritalin and other stimulants, that they have been studied in a way that is kind of like a circular logic kind of thing. So they gave Ritalin to people with ADHD, and then it helped them. So what does Ritalin do? It deals with dopamine reuptake. And so that means that ADHD is a dopamine problem. So now we can give them Ritalin. So it's kind of this circular logic that actually doesn't make sense if you think about it neurologically. And so I'm hoping that anytime in the near future they're going to start looking at the neurotransmitter imbalance in ADHD from a different perspective. But I don't know if they will or not. But I'm hoping that will happen. But the answer to what you came up with is definitely yes. They can definitely get off of the need of stimulants if their brain is more balanced. So what Ritalin theoretically does is increase the dopamine in the brain, and then they kind of stop there. They don't really explain why, if there's more dopamine, they can actually control themselves better, because when there's more dopamine, your direct pathway, which actually drives you to do things, actually is supposed to go higher, which actually is what happens when you take too much Ritalin. You get tics, you get things like that. And they also kind of forget the fact that when you are lacking in dopamine, you actually get Parkinsonian symptoms, which is lack of motion and slowness.
wow.
So this whole theory of dopamine just doesn't
make sense. No.
Doesn't make any sense, especially considering that we can see that ADHD is a more right brain problem, and dopamine affects the left hemisphere more than the right. So what we think, you know, in my world, is that most probably what happens with these stimulants is they modulate dopamine. They don't actually just increase dopamine. They actually do some sort of modulation, probably through affecting the receptor population, and not necessarily through just the dopamine itself. And having said that, so once we consider that, we understand that if we can drive the brain in a way that allows it to provide more of a brake system, then now it could actually do what it's supposed to do. And the brake system is through what's called the indirect pathway of the basal ganglia. Now, the indirect pathway is supposed to stop the brain a little bit. Okay? Now, it has a helper. It doesn't work on its own. It has a little helper. It's called the hyperdirect pathway.
Okay. Say that again. I haven't heard that.
Okay, I'll say that again. So the direct pathway pushes the brain, okay, and the indirect pathway stops the brain or inhibits.
Okay.
Okay. The indirect pathway has a little helper. It's called the hyperdirect pathway.
Okay.
The hyperdirect pathway goes to both sides of the basal ganglia, but it's unique to the frontal lobe on the right side. It originates in the frontal lobe on the right side. just on the right side.
Okay.
So when we,
Omar, can you,
yeah,
Tova, could you write that on the side there for
Yes.
the audience?
Yes.
Because a lot of our people like to do a lot of research.
Yeah.
And it's a space that they can research that
Right.
will give them productivity.
It was the interstate highway?
hyperdirect, called hyperdirect pathway of the basal ganglia.
Direct pathway of the basal ganglia.
Ganglia.
Basal, as in green garden, basal, ganglia. Basal,
So it's actually basal like base. So BASAL.
basal, ganglia.
Okay.
So pathway of the basal ganglia.
Yeah. So that actually amps up the brake system. So it helps the brain to stop. And if you think about it, a lot of what the brain does
stop or to slow down.
Well, it's always a balance between go and stop. It's never just stop completely. If you stop completely, you're dead. So we don't want things to stop completely. We want them to slow down when they need to slow down. So if someone needs to run away and flee from the tiger, then we don't want them to slow down. We want them to go.
We want it's supposed to function this way, and we're just getting it back to where it's supposed to function.
Right.
No one needs to tell the brain what it needs to do. It just needs to. Remember, in chiropractic school, we just don't want any interference, and everything will work well.
But what I like about chiropractic, and it fits completely well with with neurology in that perspective, is again, like I said before, if we generate more electricity, and that electricity comes in from the body into the brain, and it's more balanced, then the probability of the brain being more balanced is a lot higher. And then the other way around, if the brain is balanced and it's actually doing what it's supposed to do, then the instructions are actually going to go to where they need to go in a balanced way. That's the whole concept of chiropractic. Now, the thing that functional neurology brings to the table, in addition to that, is it doesn't stop at C1.
Right.
It just keeps going to the rest of the neuraxis.
But we know enormous amount of healing stories over the 200 years of chiropractic. Is it 200 years yet? But
120.
Well, stories of kids just getting better, even.
Yep. Because the body, like we always,
and the electric and the balancing of the hemispheres. So, but what you're doing is just phenomenal. Keep talking.
We're just doing it faster. That's all. We're just doing it faster because we're being very specific. That's all. We're not just using gravity and motion. We're using all of the ways that we can affect the brain, including sometimes coaching, including CBT sometimes, including neurofeedback if we can, including laser, whatever we can do to actually make the brain work in a more balanced way and in a more harmonic way. We'll use it.
Yeah.
And then again, this, like you said before, one more sentence. Like you said before, the whole point is to make anything else that they do work better. If they go to a psychologist, then now the therapy will work better. If they go to an occupational therapist, now they will get there better. If they need to get a surgery, now they will heal better. So I have a friend, a partner in another business that I have, that is now pregnant. And I saw a video of her today. She did a live today. And I was looking at her face, and I noticed that she's like this. I can't really do it. So one of her eyes is like this. And, if I looked at her, I went like this.
Yeah.
Kind of on her face on the screen. And on one side, she looked like she's 50-something. And on the other one, she looked like she's 30-something. It was like her entire facial pattern was different. And I immediately thought, oh my God, she's pregnant and her brain is totally off. So if her brain's totally off now and she's pregnant, what are the chances of her child brain being totally off? Now, the answer is I don't know, but they're probably higher than if her brain was actually balanced. So immediately I wrote her a message saying, hey, I need to talk to you about something unrelated to the business. And
but you're saying
we'll talk tomorrow.
You're sensitive enough to look at the body, to look at the language, to look at and sometimes it's expressed, you're saying, in the facial, in the balance between the left and the right?
For sure. Yeah. If the left and the right hemispheres are not working the same, then the muscle tone is going to be different.
Wow.
The even the perspiration patterns can be different because the sympathetic system is going to be different from one side to the other. They will probably have just a higher sympathetic tone overall. And there's lots of things that you can actually see very easily. They may have a head tilt. They may have a lot of stuff that will tell us, okay, the nervous system the brain isn't working like it should. Let's look.
Yes. Can I interrupt there and tell you all about Jacinda Ardern, who's the Prime Minister of New Zealand? So any ladies out there who are pregnant, don't believe what Dr. Omer said about our brains. Because they function very well when you're pregnant.
No.
I didn't say anything about the fact that the fact that she doesn't function well. I said she's pregnant and her brain was off.
Sure.
I didn't say her brain was off because she was pregnant.
No, because
by the way, she's functioning at a
her
very high level. Don't get me wrong. She's functioning at a very high level. She's juggling kids and pregnancy and a huge business.
Maybe that's what you saw. Maybe what you were reading was her stress.
Yeah,
could be. But the point that I was trying to come to get across was that there was an imbalance apparent. It was very clear there was an imbalance, and once there's an imbalance, I don't like it.
I hear you.
Yeah.
But I for our audience, I want to remind them that being pregnant is an awesome experience, and it's going to bring stress, but it also brings new life.
Yes.
And it's a very powerful thing. So yeah.
Yeah, and it can actually. I mean, pregnancy can have amazing changes sometimes. So I have a family member who developed a lactose intolerance because she got sick, traveling in South America. And then once she had her firstborn child, the intolerance got resolved. And she had it for like 6 or 7 years.
Yeah.
So I know another lady who actually got pregnant, and she delivered, and she was suffering from migraine headaches for 15, 20 years, and those were gone too. So pregnancy, can be difficult and can have, sometimes unpleasant side effects and leftover effects, but sometimes those can be, other than having a cute baby to now have in your life, they can also have interesting and positive results otherwise. So pregnancy and something I spoke to with a nurse yesterday or 2 days ago. Pregnancy is not a disease. It's not a medical condition. It's part of life.
Exactly.
And one of the sad things, in my opinion, is the addition of pregnancy and birth into hospitals, because now it's a medical condition. And I think that's one of the promoters of a lot of problems that we see. I'm not even talking about the crazy amount of unnecessary birth interventions. Just in the perception of a lot of women today is that if they're pregnant, they are now in need of a medical doctor to tell them what is right and what is wrong, and what to do and what not to do.
And they leave the hospital and they have a trauma, and it affects the baby, the next pregnancy. It's very, very sad, and it's not. It's a whole nother topic. We might have you back and talk about that topic because
it's actually related to your topic. I'm a midwife, as you know.
I know.
And the thing is that when you're in the birthing suite in the hospital and the shift changes at 3 o'clock or at 9 o'clock or 11 o'clock or whatever.
Whatever it is, yeah.
Yes, the labour slows down. Can you imagine what's happening to the baby's head as it's in the birth canal?
No.
Can you imagine what's happening when they front up to you? That old history, that epigenetics is actually happening in front of your eyes, or has happened in front of your eyes. And there are a lot more, reflecting on you coming on today. I was thinking that 20 or 30 or 40 years ago, we didn't have all this diagnoses. And I thought, neither did we have, there were more children being born at home, and then that medical intervention wasn't happening. And I would really love to see the correlation between hospitalization, labor wards, high tech, theatre lights on above you, different doctors coming in and out of that room. Yeah. So the other thing that also interested me, as you were speaking before, is the fact that it seems to be that there are more boys with these sort of difficulties than girls.
Wow.
Now, I'm thinking that that's related to environment, not genetics. Would I be right?
Well, I am not 100% sure. There are some theories about that. One of them is that, well, genetically and epigenetically, girls' brains are a little more symmetric than boys' brains. Okay, and their corpus callosum seems to be a little larger.
Wow.
So now, if there is an imbalance, and it's going, it's in a boy's brain, then that boy's brain is already more prone, if you would. So men and boys are a lot more dependent on our right brain. So if you think about it, the right brain is more about gross motor, facial awareness, um, nonverbal communication, and so if you think about going back a few thousand years, the men had to very quickly understand who's who, what's going on, where's my part in this tribe. Is it safe to speak to the leader? Is it safe to go to this female, or is someone going to kill me? So, and then if we go hunting, we have to know, is there a snake? Is there whatever? So we had to have a very good right brain, and we had to be very able to stop very quickly. And so men are more dependent. Also, the right brain is more sensory, so it's more associated with our body and feeling our body, and it's more associated with the large muscle, so gross motor. And think about it, because men and boys are more dependent on movement, if we now have something that's slowing down that right brain development, we are going to be a lot more affected than women. So that's one of the theories why we see more men with these, more boys, especially with right brain associated deficiencies. We don't see this huge of a difference in things like dyslexia and learning disabilities. We do see it with ADHD and autism and OCD and things that are very clearly right brain deficiencies. I did want to go back for a second to
there's a
what
question, but before you, this was a question on.
Really, I read it.
Yeah, is what you saw different than facial asymmetry? That's what you.
Well, there is anatomical facial asymmetry, which usually we can't really see it. So everybody's a little asymmetric, but we usually can't really see it, not with a naked eye. Just not like that over Zoom or Facebook or whatever, or what's this called? Be Live.
Yeah, and you're not, make it clear that we're not looking for straight and symmetry. We're just looking for the norm, the balance of the body comes the way it does, not symmetrical, and you're looking for balance neurologically more than.
Well, what I was talking about is actual facial asymmetry. So you could see that her one eye was a lot more drooped than the other. The nasal fold was a lot flatter on one side than the other. Whenever she was doing this with her eyes, one eye would go up, the other one kind of go halfway. So there was obvious tone difference.
Yeah,
not
tone difference, isn't it?
Tone difference.
Yeah.
Not to the extent you would see from a stroke, where someone kind of has like that.
Or Bell's
that's
palsy.
not it.
Yeah.
We're not talking about a complete paralysis or spastic. It's just a tone difference. So like when whoever is listening and does muscle testing, we're testing for tone, not strength. I can do the same muscle test on a 3-year-old kid and an Olympic athlete, and it would work the same way because I'm checking for changes in their tone and not how strong they are.
Yeah.
Okay, so this is similar in that respect because I'm looking for changes in how their tone is being expressed. So to answer that question, yes, it is facial asymmetry, but it's not a pathological asymmetry. So if she would go to see a neurologist, he would probably tell her that she's fine because she doesn't have a stroke asymmetry pattern.
Right.
Yeah.
Okay. But I did want to say something. You brought up something beautiful about seeing epigenetics at work. And it's very true. And I tell that to moms all the time when I ask them about their pregnancy and I ask them about the delivery and I ask them about whether or not they nursed and how long did they nurse. And if they didn't nurse, why did they nurse? And whenever I ask that question, especially being a man and not a woman, I have to kind of tell them, I'm not asking, did you do something right or wrong? I'm just asking if there was a reason you didn't nurse or you just chose not to nurse, which is fine. That was your choice. Because I have to, a lot of women just choose not to nurse for whatever reason. It's their choice, and I don't have to agree with it, but I do have to accept it. But a lot of times, the answer I'm getting is, yeah, I tried nursing and it didn't work, and he couldn't latch on, or I didn't have any milk.
Right.
I like that one, and then I tell them that my mom always tells me that I started nursing when I was 10 days old. And I have 3 older siblings. None of them nursed because they couldn't nurse. I was the first one who nursed. And so, in my opinion, and it's my opinion, I don't have any proof for that, if a child can't nurse, it's rarely the mother's fault. It's almost always because they have reflex problems and they can't, either their rooting reflex isn't working very well, or their gag reflex is hyperactive, or their sucking reflex is hypoactive, so it doesn't work very well. And there's actually research showing that these can be affected by Pitocin. If anybody doesn't know what Pitocin is, then well, you obviously didn't have a pregnancy in your family.
Explain what it is, just in case they don't.
Yeah, right. Well, Pitocin is a sedative that's being injected to the spine or just above the spine, and it actually kind of numbs everything from like the waist down.
Right.
So the mother is still able to deliver a vaginal delivery, but she doesn't feel as much pain. And if they have to do a cesarean section, then they will just increase the dosage so she kind of doesn't feel anything.
Right.
So we do know that can affect those reflexes. And I started talking about primitive reflexes earlier when we were in our conversation. And those to me are the major window into development. So if someone's reflexes have not been integrated properly at the right time, then their brainstem hasn't developed properly. And if their brainstem hasn't developed properly, the chances that everything else above it, so the cerebellum and the cortex and everything, develop properly are very slim, sorry. And so that's why a lot of our work starts with working on primitive reflexes. And I've seen people older than you guys, so like in their 50s.
I like that.
I gotta stop talking about age because I think it's
Right.
an effect on our pets.
I have seen people in their late 60s who still have primitive reflexes.
Wow.
I have seen people. I have seen Olympic athletes who still had primitive reflexes.
Right.
So it doesn't mean that it's not a death sentence. It doesn't mean that you're not going to succeed in life. It just means that something in development hasn't worked properly,
Right.
and we have a window into it, and now we can actually help you get better because we know how to approach it. Which is really cool.
Yeah.
And that's the whole, everything whenever I see something that's not working right, usually we can do something about it, which is the cool thing. So if you don't know that something's broken, then you can't fix it. If you don't know that something's not crooked, then you can't straighten it. So it's important to know these things, not so you can say to someone, "Hey, you're crooked," or "Hey, your brain doesn't work," because, but it is so that we can tell them, "Hey, this is where you are. This is where we want to take you. Let's start walking. I can guide you through it." And that's the whole idea.
Could you expand on that from a chiropractic standpoint, please?
Sure. I think that that's true in every, discipline in healthcare, but specifically for chiropractic, that when I see that you are out of balance, as we like to call it, so if you need an adjustment, it's telling me that the way that your brain and your body are communicating with each other is not optimal. Doesn't mean that they're not talking at all. It's just not optimal. So what I'm trying to do as a chiropractor is make sure that those pathways are running as smoothly as possible. Now, there's many techniques to do that. We can do it with a crack or without a crack. We can do it gently. We can do it.
It's a pop. It's a pop.
Pop?
It's a bubble.
I don't know. When I went to California, in California, we're all crack addicts.
It's a bubble. Chiropractors gently manipulate joints.
Well, my point is that, the audibles, whatever you want to call
I
them.
like that word, the audible.
Well, yeah, some techniques in chiropractic don't have them. Be it spring-loaded instrument techniques like activator, or a sacro-occipital technique, which works mostly on gravity, or things like what's it called? Nuka.
Toughness.
Which one?
Remember, toughness was the squeaky box, and he doesn't.
I have never learned toughness. Sorry, I've never learned that. But Nuka, which is an upper cervical technique, that's also very, very gentle. So it's kind of a perception that you have to have that. You don't have to have that. You just need to get the biomechanics to the point where it now allows the nervous system to do what it needs to do. So let me take a step back. When we develop, starting from the womb, and especially after we get out of the womb, the biggest driver of our development is our response to gravity. It is the single most important factor in our life until we kind of start developing emotions and stuff like that, and thoughts and wants.
Amazing fact.
It's the one constant in our life. It exists before we were conceived. It will exist after we're long gone. Okay, I'm not even, there's also magnetic fields and electromagnetic. I'm not going into that, but because of that, everything that interacts with gravity, so our eyes, our inner ears, and of course our muscles that have to hold us up, have a huge effect on our brain. That is why within our spine we have so much mechanoreceptors. That is why the bigger muscles sometimes have more importance than the smaller muscles. That is why our feet are extremely important. There's 26 bones that constantly 26 joints, that constantly interact with gravity and have to tell us where we are. And it's really difficult to operate in this world if you don't know where you are. So everything is...
I just said the poor kids when they don't know where they are.
Exactly. And they don't know where they are because they are not connected to their body. They don't know how to process the information that's coming in, because there's an imbalance. That's why we call them disconnected kids. Part of why we call them disconnected is because they're disconnected from themselves. They're disconnected from the environment. Right and left is disconnected. And what we're trying to help them is reconnect to themselves, to the environment, to the ground, to their own body. And so with chiropractic, we just utilize this biomechanics to access the nervous system, because it's just the easiest way that we have figured out to do that, because it just has the biggest bang for our buck, as they say. So that's the way I look at it. That's the way I explain it to my patients. I hope that makes sense.
Could I, as a non-chiropractor, share with the whole audience, all my children had ponies, and they used to go to pony club, and one of my daughters had a pony that used to kick her off quite regularly, so she'd end up on the ground. Anyway, she'd need to stay home from school a couple of days to recuperate. And then I realized there was a chiropractor down the road, and I took her down to him on the Monday, and she was back at school on the Tuesday from then on. So after pony club, we'd have to decide whether we'd go to the chiropractor or not. So
the body and the spine were made for movement.
Yeah.
So I'm not against medicine, but if something moves and becomes, there's pain, there's dysfunction, why not go in there and create some motion? Again, the body, we don't move the spine, we put a motion into the spine, and then the body knows what it wants to do because there's an innate intelligence,
Right.
that the doctor
Yeah,
within.
that's a really good explanation, because our spines are actually supported by our muscles. But what you're saying is that you're putting the energy back into the spinal cord, which is a different concept, isn't it?
Well, it's not exactly what I'm saying. Let me explain a little differently. So, hold on. I want to word it in Hebrew so I can translate it in English. um, so I'll start with an example. We just had this conversation on a Facebook group of functional neurology, and one of the ladies there was saying that she had a patient come in who has had a stiff neck for 23 years, pretty much since he was born. He's about 23, and he now came in with, like, he can barely move. And she started stroking his rooting reflex on both sides. And part of the rooting reflex is the baby turns his head. And within a few minutes, he could actually move his head. And that night, he slept with no problem. And like, he slept through the night. And it's the first time in years.
Just not,
Right, exactly.
just not even adjusting the neck, just doing the
Right.
reflex.
I don't even know if she's a chiropractor. But what that told, what the point I'm trying to say is the spine is basically a few chunks of bone. Bone is a stupid
It's
kind of
innate.
tissue.
Remember, it's inert or inert.
No, it's not inert. It's reactive.
Oh.
It's just stupid. It doesn't do anything. It just does whatever it's told to do. If the muscles tell it, if the muscles contract, then the bone moves. It doesn't decide anything. Now, the muscle is a little smarter. It can actually contract and relax, but it also doesn't do any of the thinking. It just does what the nerve that attaches to it tells it to do. Now, that nerve comes from somewhere. It comes from the brain.
That's right.
So when I, as a chiropractor, do an adjustment, what I see myself doing is two things. First of all, I'm resetting the system by changing the gain of the muscles through their effect from the spinal cord and the cortex. The other thing I'm doing is I'm sending a barrage of information up into the brain, telling the brain, hey, this is a little closer to normal. Why don't you pay attention?
Very good.
Okay. So yeah, am I changing the spinal cord? Probably. Am I causing a change in the spinal cord? Yeah, for sure. But it's all together.
Right.
I have to change the muscles. I have, the bones may have gone through some degeneration. The bones may have gone through some anatomical changes by now, because it's been like that for 50 years. So there's not much I can do about the bone, but I can still reset the way the brain perceives everything.
Wow.
Yeah.
So that now the tone, the instructions coming from above are now more balanced. And if the instructions are more balanced, the chances of blood flow being better, of inflammation being more tightly controlled,
Yeah.
of nociception being more tightly controlled, of input being more accurate, and then frontal lobe function goes up. And so the chances of the probability of all of this happening is higher now. And that's the way I see it. So to me, it's this dance that has to include everything.
Right.
But if the biomechanics sucks, then anything else I would do probably will not work as well.
Right. Because structure affects function.
And vice versa.
Right.
If you sit like this all the time, you're probably going to have a stiff neck.
Right.
If you...
Anyway, Judy has a few questions. Nice to meet you, Judith. I've not seen you on the show before. When you were talking about nursing, Judy was wondering about tongue ties. Do they play a role in all of this? I've never heard of that. Tongue
ties is when I forget the name. Sorry. Thank you. Is kind of too anterior, so it hasn't been trimmed back enough during development. So now the tongue can't come up as freely, as we would like it to.
Wow.
There is the answer is I don't know, not because I haven't looked into it, is because there are conflicting opinions. Some say that it's you have to cut it and then everything kind of works out, and some say that there isn't a difference if you cut it or not. So the answer is I don't know.
Well, as midwife, I'm on the ladder.
Yeah.
You say leave it at that.
Yeah.
Yeah, I tend to avoid knives and scissors as far as they relate to live tissue,
Right.
if possible. Because once you cut, you can never go back, and that's what I tell my patients. Once you put the knife on the skin, or whatever the soft tissue, you can never go back. And scar tissue, as in of itself, has its effect.
Is a contraction.
Yeah, it has its effect, and it has a higher concentration of pain receptors, and it's not as pliable, and et cetera, et cetera. So there are actually, there are a lot of techniques. I don't know if a lot, but there are techniques that look into scar tissue and how we can work with scar tissue. I work with one or two of those, and I see a lot of times. So one of the first patients I had that had fibromyalgia was a 26-year-old guy.
Wow.
26 guy, slim, doesn't smoke, works out, but he's hurting all the time, and he's been hurting. So, and he was a referral from my brother-in-law, who was in the States, and then I was in Israel, and so apparently, when he was 4, he fell down, hit his head on a table, and he had a small cut there. And apparently, his mom and his grandma remember that all through childhood, he kept complaining of aches and pains all the time, even when he was 12 or 13. And what my brother-in-law did before he sent him my way was actually work on that scar. By the time he got to me, he was about 40% better.
What he did some he did some myofascial?
No, he did a sensory, it's called a proprioceptive deep tendon reflex. It's like a sensory balancing, sensory reflex balancing system. It's very neat. I'm not a specialist in it. I just kind of dabble with it. I do a little bit, but it works. It works very well for a lot of things. But the point is that he did. He had like 4 visits with him with no change, and then he did just this one thing in his scar from age 4, and within 2 weeks he was 40% better. And by the time we did like 3 or 4 more weeks of care, working on his brain a little bit, he was like 80% better. And then he kind of stopped coming because he was I'm great.
You can
I
help
don't hurt.
fibromyalgia people. You can help patients with fibromyalgia with your functional neurology, or do the adjustment?
Well, what he did with him was not chiropractic. PDTR is not a chiropractic technique. It's actually developed by a Mexican medical doctor who actually learned functional neurology and learned applied kinesiology and kind of put everything together to a very neat technique.
Yeah.
But the answer is yes. Fibromyalgia is definitely one of the things that I have been working with. When I have compliance, I also have success. Because fibromyalgia, again, it's a complex condition. There's biomechanical stuff, there's emotional stuff, there's nutritional stuff, a lot of nutritional imbalances. A lot of times their vitamin D is like lower than a corpse's.
Whoa.
All of the fibromyalgia patients I had vitamin D that was below 20, most of them below 15.
So interesting.
I forget the ratio, but with the scale that's 30 to 100.
Yeah.
Forget if it's nanograms or nanomilliliters.
So interesting, Omer.
So there's a lot of stuff that you have to do there, and then they usually will have a brain imbalance because their immune system is off and their autonomic system is off, and so you kind of have, again, you have to utilize a lot of things at the same time to actually get very good results. And a lot of them are just so tired of being in pain that they don't have patience for the process, and a lot of times they give up really quickly, especially because a lot of these things cost money, and you can't give them any guarantees because that's kind of
it's out of the
can do it. and a lot of them just kind of give up before they can see results. But when there's compliance and there's cooperation, I have seen great results with fibromyalgia.
Wow, great. So I want to see if there's any more questions. Judith has one more question, but I wanted to let people know that we were going to see if anyone else, sometimes when I say that we're going to wind up, questions come in. So, and after the show, Rose is available to answer questions, and Omer has got a Facebook page, and he's here in Israel, and he's just, humble like Moses. So I want to bring up something kind of interesting, and only because it's sort of something that Rose and I learned together. Well, Rose probably knows this as a midwife, but I understood it more and more by being with Rose now, working with her for the last year. Going back to the breastfeeding, it is interesting about the reflexes of the child, but what do you have to say about the mother who's so stressed about 1,000 things and her insecurity, and the nurse and the husband, I mean, that she can't let down it. So it's like there's the emotional part. So it's such a synergetic. It has to work together. So I know you're finding about the reflexes about the child and the sucking, and that's fascinating. But
well, first of all, a lot of times during pregnancy and after pregnancy, we will see, especially if the mom has had an imbalance to begin with. So we may see recurrence of primitive reflexes.
Mm-hmm.
So we can sometimes just give her those exercises, and that can help her.
Right.
I saw the question. I will answer it in a second.
Right.
Who's that? Paula?
Yeah.
I could read that for whatever reason.
Just next time you're with the pregnant, you're with the mother who can't bring on milk, just call Rose. And she'll get the milk.
For sure. I will definitely remember that.
She'll get the milk, honey.
my point is that a lot of times we can see those primitive reflexes come back for the mother, so we can actually give her exercises to do herself, and those sometimes definitely help. But just in general, we have to remember that what's called adverse life events, pregnancy and birth can be such. Especially if she had a bad experience during the pregnancy, or she had a lot of, if she was living, if she was pregnant during quarantine and being afraid of a bug, should I get vaccinated? Should I not get vaccinated?
Very bittersweet thing. I mean, the breast is a very sensitive part of the body. It's very, very.
I'll trust you on that.
until the breast, until the nipple gets used to, it's extremely painful, and so that's another issue with.
Right. So those are the cases where I admit to having no good skills, and I definitely have relationships with some midwives and lactation consultants that I refer to, because there's I'm good at what I do, but there's limitations to what I can offer. But for sure, yeah, you have to consider all these things, and a mother can't expect, especially if she's a new mother or a first time mother, she can't expect to know everything. Back in, not even a long time ago, 30 or 40 years ago, there would be a tribe supporting her. The mother, the sister, the aunt, the grandma, and there would be all these mothers around who would help her with cooking and cleaning and taking care of the baby during the first weeks when she was getting acquainted with her new body and her new responsibility. And now they don't have that, especially in the United States, where a lot of kids kind of go to the other side of the country and they don't see their parents until Christmas, and if that, and that's a problem. And a lot of women kind of believe that they are supposed to instinctively know exactly what to do. And while there is a truth in that, if they were living in such an environment. But if you're in high tech and all you do is work in front of your computer all day, there is no reason in the world you would know how to nurse a baby. If you've never seen a baby being nursed.
Yeah, it's about fear, in other words.
It's fear, and it's just lack of understanding and lack of knowledge. And again, it's just like you're not supposed to know how to be a dad. You rely on how your dad was to you, and maybe your grandparents, if you're lucky, and that's usually how you kind of raise your kids, unless you learn something from somebody else. But if you haven't had that, or if you had a bad experience, then now you have to go and figure out and learn how to do it differently. Same goes with these supposedly simple things like nursing or birthing. You have to have someone who knows how to, who has seen it, who has done it, kind of
And there's
coach
no right or
through it.
wrong. I mean, there's it's not a science. It's an art.
No, it isn't. There's many ways. Every body is different. Every body is two words. Every body is different. Every woman is different. Every man is different. Every child is different. And I'm sure that Rose, with her experience, can definitely speak to that.
Yeah. The thing that we've neglected is the vasovagal system. So if you look at the vasovagal system, you'll see that normally you would let down, because the oxytocin will come in and the loving feeling will come about, and you'll let down. So if you're anxious and fearful, it won't let down. It's like there's a saber-toothed tiger at the entrance of your cave, and you have got to hide away.
Yeah. So
these issues are quite different. The other thing I learned from Dr. Sarah Buckley, who's a gynecologist and GP, men have also, you were saying about if men didn't see other people being fathers, for example, but we actually have all these systems in our body.
We do.
Vasovagal system puts us in alert, or on alert, should I say. So for anxiety and stress, when that comes up, the vasovagal system puts us into the fight, flight, or
freeze,
fear area. So
yeah.
we don't let down. Our baby with the tongue tied can't latch very well, because the vasovagal system in the parent is under stress. So, and for men, I don't know what the hormone is, but there is a hormone, I don't know which one it is, that actually creates that, that overarching care of the mother and the child, so that the mother and child can be connected, and the male, it has this system.
I would wager it's also oxytocin.
Pardon?
I mean, my guess would be it's also oxytocin. I'm not sure, but I'm guessing.
Well, it's some other, oxytocin, but I don't know what it is. That
I don't know.
I can't remember. I was just fascinated when I went to the lecture that there is a thing for men as well to create.
Well, as far as so first I want to give a short answer to Paula, and then I will say something about the vagal system. So no, functional neurology is not the same as functional medicine. Functional medicine relates mostly to blood tests, and how we can take the blood tests and look at them from a functional perspective, not just a pathological perspective, and then usually introduce supplements or dietary changes to affect health, which is extremely important. Functional neurology takes that into account, but builds upon that and deals directly with the brain and the nervous system. Now, in order to have a healthy brain and nervous system, you also have to have a balanced autonomic system, immune system. You have to have the right vitamins. So all these kind of, to be successful in functional neurology, you actually have to have a certain level of expertise in functional medicine. Or at least work with someone who is very apt in functional medicine to have the best result. That's my opinion. So that's just about that. As far as the vagal system, I completely agree. It's an extremely important system, and we sometimes we kind of take it for granted.
Can you explain to the listeners a little bit
I'm going to go into that. Yeah, I'm going into that.
Fascinating.
There's an excellent theory by Stephen Porges called the
Polyvagal
Polyvagal
theory.
Polyvagal theory and the polyvagal system. So the vagus is a cranial nerve. That means it comes out of the cranium and not from the spine. And it goes pretty much to all of our organs to deliver parasympathetic signals. So parasympathetic activates the rest and digest system. Sympathetic system activates the fight or flight system, the stress system. So now the way the polyvagal theory works is it says there are 3 levels of its development. The first level is associated with our freeze response. So it's very, very, very basic. It's very, very basic. Now, as our sympathetic system starts to engage and starts to develop in utero, it kind of overrides that was supposed to override this freeze response. The freeze response is kind of like a deer in the headlights, right? So that's a very basic animalistic response to danger.
Primitive.
Okay. Very primitive, yes. And then the sympathetic system kind of gets in there, and that's supposed to drive the fight or flight system. So the fight or flight means you're active. You're not passive. Either you fight or you run away. And now those are the 2 systems that are kind of active when we are born. And as we develop, we are supposed to develop a 3rd system that's supposed to kind of inhibit those 2, which is the social engagement system. Okay, so in order for us to socially engage, we actually have to have a conscious cognitive mind. And it has to have the freedom to actually interact with our environment. Now, like Rose said, when we are stressed, when we are fearful, that system kind of goes in the back seat. And then either the fight or flight system takes over, or worse, the freeze response takes over. Okay, and so one of the ways that we can help people overcome this fight or flight freeze issue is look into their Moro reflex. And if they still have a Moro reflex, then we have to have them activate it and work on it using a starfish exercise or different other stimuli. But the starfish exercise is a very, very efficient and simple exercise to do. You can go to YouTube and write starfish exercise for Moro reflex or Moro reflex exercise, and you get some. I have one in Hebrew, but you can write. If people understand Hebrew, then just write Omer Hirsh Kochav, and you'll get it. You guys are, anybody can feel free to message me, and I will send you a video of how to do the exercise. It's very simple.
Yes.
Other things you can do is actually drive the vagal system. So driving the vagal system is anything that activates the vagus nerve. So gurgling is a very, very simple tool. Vibration or massage to the abdomen. So 85% of the information going through your vagus nerve goes up and not down. So if I activate my intestine, if I just give them a mechanical stimulation by massage or by vibration, I'm actually sending a lot of information up to my vagus nerve.
Wow.
Gag reflex. A lot of kids who can't nurse very well have a very profound or a very, very weak gag reflex. Either way, their vagus system is out of balance. So sometimes just activating the gag response can a lot of times help mediate that. Abdominal breathing. Abdominal breathing is a very, very powerful vagal tool because we're forcing air to come out slowly, so we actually have to use our pharyngeal muscles to control that. Doing things like blowing bubbles, blowing balloons, blowing through a straw. All these things activate the vagal response. And I actually had, when we took our CPR course just recently, Tova, they were talking about one of the things that you can do for yourself if you feel like you're having, chest pain and stuff like that, is start breathing through pursed lips as if you're breathing in through a straw, because you're actually activating your vagal system and dilating your arteries in your heart.
Amazing.
And actually increasing your chances of survival because you're decreasing your stress response. So those are all simple tools, and I give them to almost all my patients: gurgling, massage or vibration to your stomach, abdominal breathing, humming, singing. There's a really cool tool called Resimax, which I use now, but I'm not going to go into that. So activating that vagal system also helps with that in a very profound way.
You know, when you were telling me about this, I've got a 2-year-old grandson. I've got 11 grandchildren, so I've had plenty of practice. But, you know, we tickle his tummy. We, you know, help his reflexes by playing with his feet. You know, we do all these things instinctively. And the other thing, you know, you get them a milkshake and they've got a straw and they're out in the cafe or wherever and they're blowing bubbles into their milk. And, you know, for adults, it's so annoying. But in actual fact, it's part of development.
It's unbelievable.
Yeah, they're preparing their digestive system.
Unbelievable.
Yeah. So I hope that our audience will sort of see that all these things that children do are normal. I think that's what I'm very strongly in favor of having Dr. Omer on, so that as a parent you see that whatever is going on with your child is a result of maybe some sort of trauma, but it's normal for that child within that trauma. And when you reach out to someone like Dr. Omer, you get some tools, as they say, to re-establish things. And if you just think about that blowing and all those primitive reflexes that they've got, they're all okay and they're normal. And it's about us actually stepping back and moving into that space for that child so that they can continue to grow.
And
So,
Rose,
can I finish? I just want to say, as adults, that it's important to see that you may have had these traumas and no one addressed them.
Right.
And that is the most important lesson about today. As an adult, you may have been a witness to a kid in the classroom. I can remember in England, they put a dunce's cap on this little kid.
Oh, God. Or in the corner.
Yeah, and put in the corner and humiliated. So, you know, all of this stuff happened in us and our self-esteem became disrupted, and there was this notion that we're not enough. But in actual fact, we are enough within our situation. Dr. Omer and I, earlier on, we were talking about the fact that these brain injuries set up a new world experience for the person. And then when the adults come around and want to change them, they don't move in. And if you think of how Dr. Omer has been explaining everything to you, he's actually moved into the child's area, how the child's perceiving the world, and drawing them out and allowing them to be themselves. Have I explained where you're coming from in layman's terms now? That you draw the child out,
partially,
and you allow the child to be themselves within their limitations.
Well, yes and no. I mean, I accept where they are because they are where they are, and I can't change where they are, or I can't have changed where they are. Like, I can't make them come to my office in any different state than what they are. I now have to figure out what can I do to get them to where we want to go.
Yes.
Like, I'm not angry at them for being how they are. I am trying to figure out how we can, what in their development has brought them to where they are, so that we can now shift them back to a more proper biologically, neurologically path of development.
Yeah.
That is the point. And for sure, we can see that with adults as well, for sure.
Yeah.
Because we can see a lot of adults today, and there's one of the theories about, or one of the things that probably should be studied, especially in the States, with all these school shootings that we can see, is almost every single child or shooter, sorry, if we take a look at their picture, we can see the facial asymmetry.
Yeah.
We can see how their brain is imbalanced.
Oh, wow.
And it's kind of, it's really sad, because you think to yourself, man, if I could have gotten that child in my office 6 months ago.
Yeah.
It's very frustrating. It's very frustrating. yeah,
And
it's very frustrating, but
we're all parents now, and I'm also a grandparent, and Rose has helped me be more sensitive to this by us working and talking about this. I mean, as a parent, we have these impulses. Oh, don't do that or stop that. And I'm like, it's something I'm not thinking before I'm talking, or I'm not realizing the effect on the child. And so the parent has to also, not only do they have to forgive themselves, but take responsibility.
For sure.
And everyone, it's everyone gets to understand, and no one's to blame, everyone's responsible. But there's absolute hope. And I think getting back to just the beginning of the show, you've spoken about neuroplasticity, which I thought was kind of a new thing about 10 years ago. And now I'm here thinking, chiropractic knew that, and doctors knew that. And Bruce Lipton and epigenetics is not a new thing. That's what you're saying.
Yeah, no, it's not a new thing. And I wanted to say something about what Rose said before about how we do things instinctively. And I was thinking, just when you were saying that, what does that mean, that we do it instinctively? It just means that we have a tribal or cultural or whatever memory. And these are the things that have worked. And so we stopped doing all the things that didn't work. And now we have been doing these things that have worked. Why have they worked? Because neurologically they are activating the right pathways.
Wow. That's right. Well, that's what I saw when you were describing about the children and the babies. And I'm thinking about little Tommy and tickling his tummy. And
kind of do these things automatically because they have been working for decades and centuries. And again, one of the problems of today's culture, in my opinion, because of this separation that I was talking about earlier, is that parents don't know how to tickle their kids. They don't know how to just let them eat dirt. They don't know how to just let them fall when they try to crawl and then they can't do it. And they have to hold them up so that everybody can see that my child can walk. Yes, I'm holding him, but he can walk. So we're so afraid of messing up that we don't let our kids mess up. They need to mess up.
They do.
They need to fail. The only way you can get better in anything in life is if you fail, you pay the price, that's tuition, and then you learn, and then you get better. If you don't pay tuition, you don't get to learn. And we try to get our kids to not pay tuition.
Yeah.
And because whatever, I don't know. And so, yeah.
Wow.
Thank you so much for being with us. Anyone who has got any questions, as Dr. Omer said, he will respond to you. But I will be on the computer for the next couple of hours. So any thoughts or reflections that anyone wants to talk about, whether or not it's about their chronic pain and how it would have happened, because it can be so insidious. And we've given this example. We've given the example of birth reflexes and floppy babies. We didn't say it out loud, but that's what happens. When babies are born, we do an APGAR score for them, and that tells all the other clinicians within that system where that baby is at and whether the baby needs extra care or whatever. So there is scientifically, we keep an eye on these things, but we don't know how to help them later on, like Dr. Omer does.
Yeah.
So anyone who wants
and I have
to
say there's more and more people in the world who are learning this information. We just had a conversation last night with my mentor and teacher, Dr. Melillo. We just had a conversation about that, about creating a course here in Israel through the Wingate Institute. So hopefully by next year we'll have a course here in Israel teaching this information. And there's really people all over the world, in New Zealand, in the States, of course, in Europe.
You're doing an amazing thing by educating the parents. I'm sorry to interrupt. You're doing an amazing thing by educating the parents. So I'm supporting that. You're doing a seminar, but maybe you can get that out there, or Facebook page.
So that's supposed to be the course I'm talking about, is actually for therapists, not for parents. To actually have more and more people who can actually do it. And yeah, I do try to get this information out. I have a weekly show on my webpage, on my Facebook page. Well, I hope it's weekly. I don't get all weeks in, where I talk about different aspects of the brain and development, and I do seminars and I do webinars, and whenever I can talk to parents and teachers and therapists, just give me a stage and I'll talk.
Wow.
Fantastic. Now I've got a question. Anything in English? Because when I've looked you up, it's all
There's
in
a
Hebrew.
huge amount of information in English, not
Oh.
me. Most of what I do is in Hebrew, because there's a lot of other good people who are doing it in English. But I am more than happy to do it in English. But yeah, I mean, if someone wants information in English, I can definitely send them in the right direction,
Right.
depending on the level of information they want. I strongly recommend to anyone who is interested in the whole concept of functional neurology and childhood developmental delays and issues to read the book called Disconnected Kids.
You translated it to English. So
I translated it to Hebrew.
Hebrew.
Yes, I did translate it to Hebrew about 7 years ago. There's actually a sequel called Reconnected Kids.
Kids. Oh my God,
I-
such an incredible. Who's the author?
Robert Melillo.
Robert.
Is there a way for me to type anything in the
No,
chat?
but tell me what, and I'll write it. Only I can. Robert Melillo.
Melillo. It's Melillo. I am writing to you.
I won't see it because I'm but I gave them www.lifeandbalance.co.il.
Yeah, that's my website, and they can, if they go to Facebook and they write and they type in Omer Hirsh DC, they can find me on Facebook and direct message me.
DC.
Omer Hirsh, so no C in Hirsch.
Yes.
OmerHirsh DC, because I'm a doctor of chiropractic. So they can message me and tell me they want to be my friends. I still have, I think, about 1,000 and something more friends available, and. If they sometimes I do post things in English on my on my business page, which is the short for it is LIB, so Life and Balance, LIB.
Yeah.
DR is in Doctor Hirsch, so LIBDR Hirsch. So they can search
LIBD.
LIB, so Life and Balance.
Oh yeah, Life and Balance.
And then DR, so Doctor. And then Hirsch.
I'm having
DR.
an ADD moment. What is this, Life and Balance?
Oh, this is my business webpage.
Oh, business webpage.
Business Facebook page. I mean, not my personal profile, but that's my clinic Facebook page.
Personal profile.
So if they go to Facebook and they write LIBDRHIRSH, they will get there. If you can you look at your WhatsApp?
Oh, that's okay. LIB.
DRHIRSH. IRSH.
It's good. Dot something.
Send it to
No, that's just if you search that on Facebook, then it'll pop up.
Yeah, it's good for my brain to get.
Send her a text. Send her a message with it. And
I did. Just take a look at you. There you go. LIBDR. Good.
Let's talk about the brain of an older person. And again, I'm 60. I'm middle-aged as far as I'm concerned. I'm living till 120. Rose and I are going to retire together at 120. But the brain is neuroplastic for any age, at any point.
Yes.
This is, and disease
it is.
It's just what you're talking about. You're giving us so much hope and inspiration. There's a lot I didn't know regarding this, about the brain and the ability and the environment of a Parkinson's person and the environment of a Alzheimer's person. It's about, I don't think it's so black and white, Alzheimer's, Parkinson's.
Definitely isn't. Definitely isn't. I'm actually working on I also have a startup company. It's really new, and we're actually trying to
develop all these busyness things you're doing.
We're trying to develop an app that's actually going to help with these things. Wow. Not just necessarily Parkinson or Alzheimer's, but just the brain. But yeah, if I'm going to say something about Parkinson and Alzheimer's and all these degenerative conditions, is get a lot of antioxidants. Ton of antioxidants. Make sure you have antioxidants in your diet, and if you don't have enough antioxidants in your diet, get supplements, and a lot of them. The other thing is make sure you have enough omega-3s and B vitamins. Those are kind of like, I'm not even going into vitamin D because sun is something that's we all have to have, and I'm not even talking about vitamin supplementation, just go out in the sun. But especially, in regards to those degenerative conditions, get a shitload of, a whole lot of antioxidants.
Great.
Make sure you have antioxidants in your body. I have 2 or 3 companies that I know they have good, really good products, and those are the ones that I work with. But whatever you can get your hands on it and get it in there.
Omer, somebody made me correct. I said your name. I said Omer.
That's fine. Omer is fine.
Omer. I'm Omer. Anyway, this has been so interesting for me, and so we're going to have you back, and we're going to talk about a lot of things, because you know a lot, and you just flowed, and I know Rosa and I are going to have a lot to talk about, because you brought up a lot of great topics, and there's a whole emotional piece here that we didn't touch on so much, but I'm sure you can absolutely relate to, and so we'll have you back, and we'll talk about all sorts of things. Right.
I did want to answer a couple of the questions, if that's okay.
Oh, please, Laksha.
Okay, so what was it? Oh, okay. Well, primitive reflexes, I can talk about it for 25 hours. So let me just say that, like I said before, they are normal for a baby when they're born. They should be gone by about a year. They all have their own kind of time frames when they're supposed to be gone at. So the Moro is supposed to be gone by about 3-4 months, and then the ATNR is supposed to be gone by around 6 months. And they're important because they are actually what is telling us if the child is actually developing at the right rate. And one of the things that bothers me is that we're too lenient with development. The biggest example, in my opinion, the biggest example is a child can normally walk between 9 months and 18 months. So half of their life is a normal time frame for them to start to achieve one of the most important milestones in their life. Makes no sense. It's the time frames are a lot smaller, in my opinion, for normal, optimal development. Doesn't mean that if it's not optimal, it's pathological. There's a big gap between not optimal and pathological. But primitive reflexes are the best window to that. And again, like I said, if we see them, it's great, because we know how to work with them. We know how to help them integrate. And when they get integrated, a lot of things kind of self-resolve. So that was one of the things. The Moro reflex is just one of the most important ones. It's the one where the baby goes like that. That's Paula's question. And then Sherry, I have not had a smoothie in years, so I do not get to do bubbles. But I will do it the next time I will. And then what was the one I actually wanted to answer? What was it?
What about
crawling? Yes. Well, creeping. Actually, you mean creeping. Crawling is actually on your stomach. Officially, going on hands and knees is called creeping. Crawling is when you're on your stomach and you're doing like an Indian crawl. Officially, it's called creeping when you're on your hands and knees. And yes, creeping is good pretty much in every age. You can do it if you're if you're a 100-meter dash world champion. You will probably run better if you crawl for 5 minutes before your Olympic final. Finals. Yeah.
So when should they, says Judith, when should they walk?
When should they walk? Anywhere between, let's say, 11 and 13 months is, in my opinion, okay. 14 months if we're really, really, really lenient. Actually, I'm sorry, what did I say? 11? 12, around 12 to 13 months, they should start walking. 11 to 14 if we're being a little lenient. But if it's, if they're 15 months old, then it's a little late already. If they're 9 months old, it's too early. They didn't creep enough and they didn't crawl enough. So if it's a little too late, then it tells us that something is in delay. If it's too early, then they haven't done enough of something else to properly integrate it. I just, it was important for me to answer those questions.
Yeah.
Thank you for that opportunity.
Yeah.
It's been a wonderful morning,
Yeah.
evening, whatever, wherever you are in the world.
Almost night, yeah.
And night if you're in India or China or...
Yeah. And
almost midnight here. So.
I'm excited that this recording will be on our YouTube, and I'll send it out for a few days to the Facebook pages because it is just chock full of information. Really, really, really happy to have you here and to be a colleague and to have you hang out with Rose in the round table, and excited about this. So we'll meet again. Thank you so very much.
Thanks for having me.
Yeah.
It was great.
Good night. Good morning, Rose. Take good care. Bye.
Bye.
Take care, everyone.